I'm David Chieng. I'm a cardiologist and a fellow in electrophysiology and pacing at the Heart Center at the Alfred Hospital. So my main project is looking at heart failure with preserved ejection fraction, or HFpEF, and that's increasingly recognized as an important form of heart failure. Almost 50% of heart failure cases worldwide is due to HFpEF. And in HFpEF, what happens is that the heart contracts normally, but it doesn't relax fully in between contractions. And due to this abnormal relaxation, pressure builds up in the lungs, and patients often feel breathless, especially when they walk around. And unfortunately, patients with HFpEF, they also tend to have atrial fibrillation, or AF, which is the most common heart rhythm disturbance worldwide. And those patients who have HFpEF and AF, they tend to do worse long-term compared to those with either conditions alone. There's a lack of effective therapies in patients with HFpEF. Earlier studies have shown that a minimally invasive procedure to treat AF, done through the groin, called catheter ablation, can improve outcomes in those with HFpEF and AF. However, there is no randomized study to evaluate the role of catheter ablation in those with HFpEF and AF. We undertook the world's first randomized study to compare catheter ablation versus usual medical care in those with HFpEF and AF. So participants who had HFpEF and AF, they had several investigations at the start. So firstly, they had an exercise right heart catheterization, where we put a tiny catheter up into the lungs and we measure the pressures at rest and also on exercise. They also had a cardiopulmonary exercise test, where we look at the gas exchanges, the oxygen and carbon dioxide levels, and also we assess their cardiac fitness during exercise. We also get them to fill some questionnaires to assess their quality of life at the start of the study. And then these patients were then randomized to either AF ablation or just usual medical care. And after 6 months, we perform the same investigations again to look at the differences in outcomes between the two groups. The average age of the study group was about 66 years old, and over half were females. And we showed that catheter ablation and restoration of normal heart rhythm at 6 months resulted in significantly lower pressures in the lungs. These patients were also able to exercise longer and better, and they also reported significant improvements in their quality of life. So in this world first study, we had shown that catheter ablation in patients with HFpEF and AF does result in significant improvement in health-related outcomes, and therefore catheter ablation should be seriously considered as a treatment modality in those with HFpEF and AF.